So good afternoon. I kind of got the impossible task of talking to you after lunch. You're probably 1 hour after lunch, so you're probably tired. And I have around 12 minutes to talk about the project I've been working on for the last 3 years with my team, where we moved from not knowing anything about Parkinson's disease or healthcare technology to roughly 1,000 patients wearing our platform every day and around 1 million of hours of data from Parkinson's disease patients. That is probably the biggest data source that exists today in Parkinson's disease research. So I thought the best way to keep you alert and awake is to show you pictures of celebs. So you probably know one of them. I'm not sure if you know the second one. So the second one is Andy Grove. Andy Grove is one of the founding fathers of Intel. And he actually had Parkinson's disease. He passed away this year, sadly. And around 3 years ago, Andy Grove read an article in the New York Times, and basically the article was about big data. And he, being a technology guy, he said, well, maybe this can help with Parkinson's disease. So he sent a mail to one of the executives at Intel, and she knew about our group. Basically, we do big data analytics for Intel. And one day we got a mail. We got a mail from Andy Grove. Now, when you get a mail from Andy Grove, there's only one answer. Sure, we'll do whatever you want. We'll work with you, right? So that's what we did. We started a team, and we started working on this project. And Andy Grove got us to work with the Michael J. Fox Foundation, which have been our partners in this project for the last 3 years. And we built this platform that I'm going to talk about. So a little bit about Parkinson's disease for some of you who don't know much about it. So it's, which I didn't know a few years ago. So roughly 6 million patients around the world, 1 million in the US. There's no cure for Parkinson's disease, okay? So basically all the medication is helping with the symptoms, okay? So if you think about Parkinson's disease patients, they take a lot of medication through the day. There's no test to figure out whether you have Parkinson's disease or not. And there's no progression marker. So there's no test that will say you're here in your progression of the disease, okay? So when we started working, we looked at the challenges that exist with working with patients in this disease. And we noticed few things. First of all, they go to their physician once in 6 months, okay? So if I ask you what you ate last week or how you felt last week, you probably don't remember. I don't remember as well. I don't remember an hour ago. But think about them, a physician asking them how you've been in the last 6 months. So they don't know. So being able to provide them something that will tell them a picture about how they've been doing in the last few months is something that can help them. The second thing, when we look at the research point of view, the research is extremely expensive, as you probably know, and not a lot of patients contribute to the research. So we were looking for ways how we can get more data from more patients and expand it, especially since we know big data, and we thought, well, we want big data, we want a lot of data, right? So this is where we started. These are the challenges we tried to address. And the way we do it was pretty simple. We said, let's start by focusing on the patient. Okay? I know in most cases you don't start with the patient, but we decided this is probably the best approach for us as a technology company working with the Fox Foundation. We decided to understand the patient first. Okay? And from a patient point of view, we understood pretty quickly that we need to build a very simple to use solution. Okay? So from a patient point of view, they need to do two things. They need to take a smartwatch like mine, okay? Put it on, download an application from the App Store, like most of us do probably, or our kids do in my case, many times, and start it. That's all they need to do, okay? Now, once they start it, we'll start basically the interaction with them. We collect information, everything is behind the scenes, and also there's interaction with the application that I'm going to show you later on. So from a patient point of view, we did something which is extremely simple, and that they can use 24/7 for long time periods, because we want them to use it for months. We didn't want them to use it for 1 day and then throw it away, okay? So that was our goal. From a platform point of view, this is a big data platform. So basically, we take the information from the smartwatch, we move it to the phone. From the phone, it goes to our cloud. And in the cloud, we have basically a big data repository. All of these steps, in each one of them, there's different algorithms that we built to manage the data, handle it, turn it into information, and something that is meaningful for us and for the patients. Okay? So while building this, the first goal that we had was to provide back insights and value to the patients. Okay? Why? Because we want them to use it. We understood pretty early that if we don't provide them something, some UI, something they can use, they will just not use it for a long time period. Right? So we provide them the insights that I'm going to show you some screenshots later on. But that's how we got them to use it for a long time periods. And this was through an application. So now that we have all this information from them, and I'll show you how we collected it, we have everything in the cloud. We can now provide it to relevant different teams that might need it. So all of this data, since this is a pro bono project between us and the Michael J. Fox, all this data belongs to the Michael J. Fox Foundation, and they provide it to everyone. So anyone who wants this data can access and get this data and use it. So this is from a research point of view. From a clinician point of view, now, once they have the discussions with the physician, they can see what happened in the last few months, right? Because they wear it and it collects the data all the time. So this is a project I'll talk about later on that we're now doing with clinicians to provide them with the information they need so they can understand what happened in the last 6 months. And of course, the third piece is the pharmaceutical companies, and this can help them reduce the cost and the time it takes to do clinical trials. So these were our goals. So the application is called Fox Insight. It's available in iOS and in Android if everyone wants to download it. Not that I think that you should, but if you want, you can look at it. It's basically does several things. The first thing that we did, we spoke to many patients, and they told us that the one thing that bothers them is their ability to take their medication on time. Now, a Parkinson's disease patient might need to take a medication every 2 hours. Okay? Think about every 2 hours you need to take a medication. If you don't take it, then it impacts your symptoms. So they needed something to remind them when to take their medications, etc. So we built a medication management tool. Okay? So they can basically set up the different medications, when they want to take them, what's the dosage, etc. Okay? Now, this is very nice for us as well, because now we have a way to understand when they take the medication. So we collect a lot of information from them, but now we can correlate it to the time they took their meds and figure out whether the meds are working or not, right? So we can show it to them and provide to them the understanding of, this is when I took my meds and this is how it impacted me, which was very powerful. And also in our data sources now, in the databases, we have all this information about when they took their medications. Now we built it in a way that it alarms them on the phone, it also alarms them on the watch itself. Did I jump? Yeah. Okay. The second thing is we wanted them to be able to provide us with information about their symptoms so that researchers can better understand, and for us, but also for researchers can better understand what's going on and ask them certain questions at certain times. So if you do a clinical trial, you might want to ask them once in, I don't know, half an hour after they take the medication, you want to ask them what are the symptoms, how they're doing. So this allows for that. And we can also ask them different questions. So it's configurable. A researcher can say, this is what I want to ask them, this is when I want to ask them, and eventually they can use this tool to interact with the patients. The third thing is basically behind the scenes, we collect all this data, we analyze it. This is how we provide them insights about their symptoms. So you can see activity level, how active you are throughout the day. You can see the tremor level. You can see how well they sleep. And the patients can see this in real time. So they have it in the application all the time. Whenever they want to see it, they can look at it. They can look at weekly summaries. And of course, they can show it to their physician as well. So all of this data is available. But also, if you look, I don't know if you can see, but there's red pills. So this is when they took their medication. So they can see when they took the medication and understand how it impacts them. Okay, everything in the tip of their hands, basically they can see the data. How we built this? We did a set of clinical trials. These are small clinical trials in a clinic with physicians, making sure that we have the relevant data to build the algorithms, because we needed very accurate data. But then once we have all this data, we build the algorithm, we went and did a big population study, where we have, as I said, around 1,000 patients using the application today here in the US and in Europe as well. So this is a list of basically our partners and the groups that we work with. Intel is a technology group, so basically we need the researchers and academia and medical institutes to work with us and to provide us the the other side of the story, not the technological side of the story. So we started with small clinical trials. You can see the first two are around 30 patients. The third one was actually interesting because we wanted to see if the patients will actually use it, right? So we did a small population study where we actually sent them the kits and we asked them to start using it. And that's how we learned whether they're going to use it or not before we went to the large scale, invested a lot of money in a large population study. The population study, as you can see, is a large number. We hit around 1,000. We want to hit around 4,000 patients. And the last one that we're working on is with clinicians. So we have several locations here in the US where clinicians are going to use our platform with their patients and provide us with the input of how a platform for clinicians should look like, so it will be usable for them, because we understand that what the patient sees is not the same thing that the clinician will want to see. So with this, I'm going to just say that I don't know exactly how it's going to look, right? So we started with sensors that are on a watch. It's probably going to be different sensors in the future. I don't know how it's going to look. But I know for sure that this is going to be part of our future. Those sensors, collecting information from all of us and getting better therapy for different diseases as part of it is for sure something we're going to see even more. So thank you.